Welcome to the Airway First podcast. I'm your host, Chloe Appleberry. Today's episode is about obstructive sleep apnea. Since I started learning about pediatric airway health, I've heard a lot about OSA, or obstructive sleep apnea. Well, what is it, and why does it matter when it comes to children? Is it something that is only related to those who are overweight or obese? Our guest today is a renowned clinician, educator, and advocate in dental sleep medicine, Dr. Steve Carstensen. Dr. Carstensen has dedicated his career to understanding and treating sleep-related breathing disorders, and he's at the forefront of airway-focused care. He explains what obstructive sleep apnea is, common signs to look for, and why parents and expecting parents should be informed about obstructive sleep apnea, as well as the importance of remaining curious as to why your child might be experiencing symptoms that are related to an airway disorder. Let's get started. Welcome back to the Airway First podcast. Today, we are joined by Dr. Steve Carstensen, an internationally recognized leader in dental sleep medicine and airway health. With over 40 years of clinical experience, Dr. Carstensen has made significant contributions in the field of obstructive sleep apnea. He has co-founded Premier Sleep Associates, a dental practice dedicated to treating OSA and snoring, and he serves as an educator and advocate for effective dental solutions to sleep-disordered breathing. Dr. Carstensen is a board member for the Children's Airway First Foundation, helping advance research and advocacy in children's airway health. He is a diplomat of the American Board of Dental Sleep Medicine. He has authored and contributed to numerous publications and continuing education programs on obstructive sleep apnea, and continues to educate practitioners around the world on early identification and multidisciplinary strategies for OSA care. His business coach also calls him a fierce advocate. Dr. Carstensen, thank you so much for joining us today.
Oh, it's a pleasure to be here, especially for this kind of effort.
Awesome. Thank you so much. Can you explain to our audience share your journey into dental sleep medicine and what inspired your focus on sleep-disordered breathing?
Sure. Well, like most of us in health professions, it starts with family. My father was an epic snorer. I mean, if he was down the block sleeping right now, we'd hear it, right? But so I grew up with that as kind of the norm. Mm-hmm. As I was moving, on through my professional career, a mentor of mine, Dr. Keith Thornton, who was one of the pioneers of dental sleep medicine, and I became close. And he was a mentor in regular dental care as well as dental sleep medicine. Okay. So he would bring me along as he learned new things and became a more impactful teacher. And I got to connect that with my dad. And so I was realizing that snoring I was hearing wasn't normal. Mm-hmm. And then a patient showed up in my practice named Greg, and he said, "Can you fix my sleep appliance?" And I said, "Well, sure." Then I asked him, "What's a sleep appliance?" And it turned out to be what we commonly use today, one of them. And I fixed it, and then I was asking him his story, and it was extensive and troublesome for him to deal with this for a lot of his career. And putting all these pieces together, it became fascinating to me how the problems breathing interacted with the things I was seeing in my dental restorative career and in my own family. One trip we had, my wife and I were visiting with my dad and mom in a condo, and the condo was bad enough. But the last night of our trip, we shared one of those hotel rooms that has two different bedrooms. Yeah. And at 1 a.m, I found my wife in the bathroom because there was one more door between her and my dad. My goodness. We both ended up in the van outside. And then so I started talking to Dad. And then a few years later, he calls me and he says, "Steve, what's this about this sleep apnea?" And I said, "Well, Dad, I've been talking to you about it for 6 years. So why are you calling me now?" And it turns out that he realized he was falling asleep driving home nearly every day. Oh, wow. And catching the shoulder of the road. And he said, "Steve, in a couple of years, when I'm going to retire, and your mom and I are going to get in the RV and drive to Alaska. And I don't think I should fall asleep driving the RV to Alaska." And I said, Dad, I don't think you should fall asleep driving home from work. And so we finally got him diagnosed. He got on a CPAP, used it every day for the rest of his life.
Okay.
And it made a giant difference for him. Well, so that's my origin stories.
Okay.
But then as I was going forward with learning how I was going to help my practice patients and my dad and all this, the physiology of it became fascinating to me. And so I realized that as a teacher in dentistry, I was already doing that part. I could bring this message out to more of my colleagues.
Amazing. Can you explain to our audience, what is obstructive sleep apnea?
Sure. When we breathe, we have an open airway behind the base of our tongue, behind our palate. So we breathe through our nose, it goes through an open space into our lungs and goes out the same way. When we relax at nighttime, especially think about when you're sleeping on your back. What if your tongue falls backwards and narrows down that space, or even falls completely to the back of your throat, and so you can't breathe any air at all?
Wow.
That's obstructive sleep apnea.
Okay.
And humans are able to have this problem for the same reason we can speak and sing and do all the things that we do with our vocalization. We have independent structures in the back of our throat that allow advanced communication, but also this obstructive sleep apnea. And the lack of function of the muscles that protect the airway that are happening while we're awake. When we're awake, we breathe in, that's negative airway pressure, it pulls air into our lungs. But we have muscles that resist the collapse in that negative airway. At nighttime, those muscles don't work as well.
Okay.
And so that closes down the airway. So the body can't breathe. And the brain responds to that and causes a lot of downstream problems.
Okay. In your experience, how has the understanding of OSA changed over the past 2 decades?
Oh, I love this part. When Dr. Kristen Guilleminault and Dr. William Dement, about 60 years ago, were able to identify obstructive sleep apnea in sleep labs in California at Stanford.
Okay.
They had ability to measure physiologic response. They could watch a patient, hook them up to a bunch of sensors, and they could see what happens when they stop breathing.
Okay.
But that technology was inky lines on paper and physical observation. Well, that's not near as technically advanced as it is today, of course. And so what's changed is our ability to understand the implications of what seems to be a fairly routine mechanical problem, which is the closure of the airway or a narrowing of the airway, which is snoring, like my dad. And so what we have now is the perception of how the body responds to those events. And then we think about how the body responds over a lot of years to those events. And then that gives us connections with long-term problems like cardiovascular disease.
And so from my understanding of obstructive sleep apnea is that it only happens to people who are overweight or desperately need exercise and they can't sleep at night. Is that the case at all times?
Well, that's where it was discovered.
Okay.
Because what they were realizing, a group of physicians, including another mentor of mine, Dr. Remmers, were noticing that overweight, older males were dying in hospitals.
Yeah.
And so Dr. Remmers, who was part of the discovery of the disease, his job as a young resident was to keep one of these guys alive at nighttime by waking them up so he could breathe again. And that led to further discoveries. But it was known as an overweight old men's disease for a long time.
Okay.
But again, technology, as that's advanced, as clinical expertise has advanced, we've realized that nearly anybody can have problems breathing at nighttime, including obstructive sleep apnea. It's a spectrum of disease, by the way. Obstruction, where the tongue falls back, the palate seals off the airway. That's one end of the spectrum.
Okay.
Snoring is maybe the other end of the spectrum. And in between, there's problems breathing at nighttime.
And concerningly, they're finding it with children as well now.
In my practice, I was taught about how to help adults with sleep apnea by making specialized appliances that go in the mouth.
Okay.
Well, fine. As I was looking at these 40, 50, and 60-year-olds in my practice, I was realizing that one time there were 4, 5, and 6.
Right.
And I was working with the anatomic problems that helped cause this difficulty in the 40, 50, and 60-year-olds. I thought, when did that anatomic problem start?
Right.
4, 5, and 6. And so that got me thinking about kids
Mm-hmm.
and plugging into a group of like-minded professionals around the country who had already started thinking about kids.
Mm-hmm.
And I realized, wow, there's our future, because this is what dentistry can do,
Yeah.
is to pay attention to the little ones
Mm-hmm.
and not turn them into the people that were seeing me in their fourth, fifth, and sixth decades of life.
That's so impactful and important. Can you explain the connection between oral and dental health and the development or management of OSA to those watching?
I sure can. And one of the things I would like us to start moving away from, Chloe, and not to be critical here at all,
Mm-hmm.
is I realized not too long ago, actually, that the language that we use is important.
Yeah.
The OSA, like you mentioned there, and a very good question about, how does this oral health contribute to OSA? Realizing, again, spectrum of disease. And if we focus on OSA, we miss early signs, especially in kids, and I'm sure we'll get to that in a minute. But oral manifestations, what can we see in the mouth of people that might be at risk for sleep-related breathing disorders?
Okay.
Okay. And that could be things like a narrow palate, or certainly bad habits like mouth breathing. In my dental practice, from my training in dental school, they taught me that when a kid comes in to see me, and in early years in my restorative practice, I saw children, and they had bright red gums across their front teeth. I was told somehow that they didn't brush well there for some reason. And so I would ask these children, probably hopefully nicely, that how can you not brush those teeth? You brushed your back teeth fine. Why not those teeth?
Right.
But now we realize, and certainly I realize, that that's a microbiome problem because of mouth breathing. And so the troubles that we see in the gingiva around the upper front teeth, if they're bright red and not healthy looking, because the kid's mouth breathing.
Oh.
And then mouth breathing turns out to have a huge amount of downstream problems with it that affect physiology, affect growth and development, affect health of the child and how well they do in everything that they do in life.
Wow.
So mouth breathing is a big trouble.
A big trouble.
It's also a pretty easy to identify sign.
Okay. Yeah. And speaking about signs, what are some of the more common signs that you look for when you are screening patients for airway issues that might lead to OSA?
The American Dental Association asked to create a brochure.
Okay.
So a colleague of mine named Glenine Varga and I wrote a brochure years ago called Children's Airways. And what we realize is what we have to do is get to parents, what are some cardinal signs? What can they look for that's easy to spot? And so we settled on mouth breathing and noisy breathing, because breathing should be silent all the time. Mouths should be closed and breathing through the nose all the time, barring some, cold or some other reason why they have a short-term congestion of their nose. But if a child is doing any snoring at nighttime or any breathing sounds or breathing through their mouth anytime other than heavy exercise, then that should be a warning sign that there may be something going wrong.
Okay. Can you talk about the importance of collaboration across dental and medical fields for early detection of obstructive sleep apnea?
Oh, this is another favorite topic. Let me reference it with my adult practice, because in my adult practice, a sleep physician does a diagnosis, prescribes, say, an oral appliance, and then I do the oral appliance, and then the sleep physician retests the patient. So it's kind of a two-doctor situation to help the person out.
Okay.
Sometimes there's additional doctors. In children, there's no one part of medicine that can treat this at all. Sleep physicians have a role to play in some children. Dentists are the masters of the craniofacial respiratory complex, the whole part of the face that has to do with the airway, the oral cavity, the nose. And we're the only part of medicine that understands growth and development of that section of the human body. And it only grows during the first 10 years of life. And so we have that responsibility and also the expertise to deal with that. No other part of medicine does. But one of the things that comes along with growth, proper growth of the craniofacial respiratory complex, is proper function. Well, we're not taught in dental school how to help make sure the child can properly say their sounds or swallow correctly. That's speech and language pathologists. And it's correlate orofacial myofunctional therapists. So we need to have those functional people to go along with our structural analysis.
Okay.
Then children oftentimes have allergies that cause response in the tissues that surround the airway. And that means an allergist might be on board. We might have kids that are compensating for bad breathing such that they have bad posture. So they hold their head in the wrong place, so they already have a compromise somewhere else. So we might need a physical therapist or even an occupational therapist or some kind of body worker to help them with the kinds of tools and new directions of effort to get them back on track if they've wandered off of the proper health track. So in children especially, it always takes more than one person.
Yeah. Yeah. That's so impactful that there's so many people that are willing to help and are needed. It's a team effort.
Sometimes it's hard to find them, though.
Oh,
So
okay.
oftentimes when I'm at conferences and I talk about that kind of subject, oh, how do I find a physical therapist? How do I find a myofunctional therapist? They're out there,
Yeah.
and you just have to be diligent looking for, be persistent. One of the challenges, but
Yeah.
one of the rewards is when a family comes back and says, oh, that myofunctional therapist that I've been working with, my son can now, say their words better and they swallow better. It's so great to have that done.
And it's so interesting that you mentioned that. We were recently at the Airway Palooza event, and it was such a fascinating event. You were there, you spoke at that. It's fascinating. And a lot of the dental professionals, but also myofunctional therapists, all the advocates for children's health, they were coming up, how do we get on board? How do we get on board? So many people, they want to get on board with helping out and being there and being a resource for children in need. So you're right. So we just need to get the word out that this is the problem. We do need doctors and we need people willing to help.
It's a supply and demand issue, but
Yeah.
not an economic supply and demand. It's not like there's not enough widgets to buy.
Right.
It's a matter of how many families are demanding care for their children,
Right.
and how many healthcare professionals are able to supply that demand.
Yeah.
And the more demand there is, the more hygienists, for example, that might be willing to take the classes to become an oral-facial myofunctional therapist, the more pediatric dentists that might understand more about the growth and development of the craniofacial respiratory complex. This, the more the professionals will dig into their part of their contribution and be able to provide it.
That's awesome. Recent research has shown that obstructive sleep apnea during pregnancy is linked to several complications for both mother and baby, including increased risk of high blood pressure, gestational diabetes, preterm birth, and even impacts the fetal growth. Could you elaborate on how obstructive sleep apnea affects pregnancy outcomes and what steps can be taken to mitigate these risks for both mothers and babies?
This is a very fast-moving and fascinating part of medicine.
Yeah.
It seems like every week I read a new paper
Something
about
new.
what they've learned.
Yeah.
Because why? They can't do tests on pregnant women, right? We don't do studies on them. We do observational things. What did we see and what happened? And then we start to draw conclusions about that. We, meaning the collective medical scientific community, not me.
Right.
So what I read, though, is that, first of all, bottom line, never hurts to breathe well. And then if you have the changes in a woman's body during pregnancy can lead to obstruction of the airway. Tissue changes, shape changes, muscle behavior changes, all of these things contribute to less ability to breathe smoothly every night. And the deeper into the pregnancy, the more likelihood that is to be. What they're learning about now is this known quantity of poor breathing by the mother is starting to have short-term and long-term impacts on the child. No, we don't know a lot about long-term impacts because that takes a long time to know that.
Right.
But we're noticing that we're getting changes in birth weight, changes in early adaptation response, changes in slower elimination of what are called primary reflexes, things like, feeding reflex. You don't have to teach a baby how to feed from the breast. Well, fine. It's just that there's like 8 primary reflexes, and we're seeing changes in how they fade away on a longer time frame than they should. Well, what does that mean? Nobody really knows, but they're studying. But it's fascinating how they're connecting that now with the changes in respiratory patterns, changes in CO2 balance, changes in oxygen balance because of bad breathing during especially the third trimester. What is necessary here is, again, a reframing because again, the sleep medicine profession is aimed at obstructive sleep apnea.
Right.
They know how to diagnose that. And so they take a woman who comes in, says, whatever she complains of during pregnancy, and they say, well, you might have OSA. So let's test you for OSA
Right.
instead of paying more attention to other things and getting her treated.
Okay.
Yeah.
I like that. That's very important to look at the whole picture, what is
Yeah.
going on. Yeah. There's been buzz around over-the-counter devices and interim oral appliances.
Yeah.
Do you see these as helpful for certain patients, or do you recommend custom devices only? What do you
I
think?
love interim and over-the-counter oral appliances
Okay.
in this way. Somebody thinks, I have a problem. I may have a problem, or my wife says I have a problem, or however it is that they come to the conclusion that they have a problem. And they look at an option to buy a $50 over-the-counter device and see if they get better. They come to see me when they've gotten better, but the appliance doesn't fit well. So what they've got is a glimpse into a preferred future. Something was better for them because of the trial of this interim appliance.
Okay.
And that gets them a better mindset for, let's see if we can fix this for good. And what I do in my adult practice is make custom mandibular advancement devices. They fit well, people like them, all those things. It's always just a management issue. It's, I don't fix anything. I manage things and I help guide them into better fixes maybe. But step by step, some people need more steps than other people. So I don't have any trouble with that. Now, the trouble we have with interim oral appliances or temporary ones, over-the-counter ones, is if somebody rules out, oh, this can't possibly work because this one didn't.
Okay.
I think most adults realize that it wasn't made for them, and so that's not a problem. Another issue you didn't quite ask about, but I do want to bring it up, is that in adults, what we're seeing now is self-made appliances.
Okay.
So there's businesses out there that will send an adult an impression kit. You take your own impression, then they make a device for you that is purported to be custom fitted. Those I think are a little bit more dangerous because although it's fairly simple to hold the lower jaw forward for an adult, there are complications. And I think professional oversight is necessary. In children, thankfully, we don't have do-it-yourself expanders. That's I hope we never see that because that absolutely takes multiple professionals to make sure that child gets on the right track. And we only have a few years to get that done.
Yeah. Dr. Carstensen, you have played a major educational role in this field. What messages do you consider most important for dental or medical professionals entering the sleep field or people who are just curious about the sleep field in general?
Well, you said the key word, curious. That's my favorite thing to advocate for is stay curious. If you see things in your adults that you can't really explain where the etiology came from, and one of them is like sleep bruxism, or one of them is gingivitis, dry mouth. Why does that person have that? Be curious. Look for the reasons why. In children, if they're having, again, mouth breathing or nose or noisy sleep, why is that? Don't stop with the symptoms or the signs. One, be curious about what goes forward. And then be persistent in education.
Okay.
So learn more. I mean, that's what happened for me. I found it to be fascinating. That's not going to be true for every dentist. Not every dentist wants to learn all the things I've learned. That's okay. I don't want to. There's plenty of things I don't want to learn about in dentistry as well. So, be persistent to be a good doctor for your patients. And then another point is that there is no part of medicine that can dominate breathing problems because breathing is so critical to our entire physiology, which means that every part of healthcare has a place at the table. And there's no part of healthcare that's more important than another part of the healthcare for breathing. So dentists don't need to feel like they're in second place. That stems from the kind of thinking there was back when we were learning about obstructive sleep apnea in overweight old men. And so CPAPs and then oral appliances and then other things. Well, in children, especially, there isn't that hierarchy because we're not dealing with OSA and overweight old men.
Right.
We're dealing with structural and functional problems. And so we are probably the most important part of medicine for that. And we need to claim that space. We need not an exclusion of anybody else, but also not in second place there.
Dr. Carstensen, thank you so much for your generosity with giving us the information and joining us on our podcast today. We hope to have you back.
Oh, I can talk about this stuff for a long time, Chloe. You don't have enough time on your podcast for this.
I love it.
Thank you for the invitation.
Thanks
I
for
appreciate
being
the
here.
opportunity.
Thanks so much. Thank you so much for joining us in our discussion with Dr. Steve Carstensen on the science and significance of healthy breathing and OSA. As we have learned, recent discoveries have expanded our understanding of how OSA develops, who is at risk, and why proper airway functioning matters every hour of the day and at every stage of life. We hope that this episode will empower you to recognize the vital role of airway health and inspire you to take action, keep on asking questions, and support those working to promote better breathing for all. Stay tuned for more conversations and do not forget to like and subscribe. Thank you for supporting our channel. We will see you next time. Until then, take a deep breath, stay informed, and stay inspired. Bye, guys.